Thank you, Jeroen. Thank you, Julia and Charlotte, for organizing, for taking this lead for this great webinar. And I'm very glad to talk about our network activities. And I'm happy to talk about following points. So I will give you a bit about motivation and background about our work, talk a bit about what could be part of an optimal validation world. And finally, I will go over to some specific actions we're currently running through our network. So first of all, you can see here is our methodological box we are using at our mental health lab. So we are interested in capturing different measures in daily life, for example, mood and stress through electronic diaries and GPS signals and mobile sensing. And of course, we are interested in variables and how they are associated with different constructs. And a couple of years ago, we started as a small group with first as a simple question: which device algorithm can validly measure which part of the 24-hour physical behavior construct, which means physical activity, sleep, and sedentary behavior. And as we started with this review work, we recognized very early that it is not feasible to find an answer because the heterogeneity between different protocols and studies are large. Therefore, we shifted a bit our focus on the quality of the studies, and therefore we preliminarily focused on how well performed the protocols compared to criteria. I will jump directly to some specific results. Overall, we identified over 900 studies between 1970 and 2021. Overall, 391 devices and different models across different companies. And a further number is that nearly 200 devices were only identified in one single study. I will talk a bit about this number later when we talk about the maybe optimal validation world. Only or less than 1/3 of all studies were conducted under free living natural conditions. We identified 7 different reference measures. Most of them used indirect calorimetry or video observation. And over 70% of all protocols focused on an intensity parameter such as energy expenditure or steps. There's much more numbers, and if you go into details, very interesting. For example, just 10% used adolescents as a target group, and maybe the most critical number we identified that over 75% were rated with a high risk of bias. And here are some more summaries of this work, and I do not want to go into details too much, but for example, you can see here, regardless if you are looking at intensity, sleep parameters, or postural activities, there are very low studies with a high quality. And when we go further, we use this large amount of data to visualize different parts. This is just a quantification of how often different devices were validated. And I just want to refer to an earlier study, and please note that this doesn't tell us anything about the quality. It's just a quantification, and we have to keep in mind that also the algorithm is, of course, a very important part when we're using such a device. Here is another figure, maybe not very surprising. You can see here for different locations at which positions, which construct were validated. For sleep parameters, the wrist one is the predominantly position. For the posture part is the Taiwan position, and physical activity or intensity parameters were restricted across different positions. And as a take-home message from all this work, I would say from our point of view, there's an imbalance between the important task of validation, the responsibility for it, and its allocated resources. And if you ask me about the picture, I would say is not in a balance. How important it is and how many resources we have. And this was the starting point to change things or to continue our work and to add some work in on the left side into the resources pod. And before I go to the specific actions, I will ask myself, what is necessary for a perfect validation world? And I would start with, we need to understand that we cannot validate an algorithm, a device in just a single study. It's a process. We have different target groups with different locations like laboratory or free living. So we need to understand, we talk about the process. We need high quality protocols. And at the end, we need also reporting for comparability and to understand the impact. And I will go step by step for a screening about different works in our space. And I would say we have this brilliant work from Sarah Kiedel. If you missed her presentation from yesterday, I just can encourage you to watch the recordings afterwards. Sarah presented the framework, and it is very helpful because we can now understand that from manufacturing an algorithm or device, we need several studies until we should or maybe could adapt it into application studies. And this work is I would say an eye opener to understand a single study is not sufficient. We need more than one study, especially those phase 3 studies under naturalistic validations. And if you remembered my my summary from the database, we identified so far only 30% of all studies were conducted in this area. So we need definitely more studies under naturalistic conditions. Then we can go ahead to protocols. And when we look back in 2012, there were already very nice recommendations and articles providing brilliant suggestions of how we should validate and set up protocols. And a couple of years later, again, another great work highlighting the necessary step for high quality protocols. And recently, the Interlife Network, a bit more formalized group, set up different protocols for different outcomes. However, if we see the quality of the studies, those recommendations were not changed, not too much the type of how the people conducted single studies. But if we go through those protocols, we can see a lot of good recommendations for high quality protocols. And just some impressions, they all recommend to use high quality of reference measures, optimally like video recording. But I'm also happy to see that we are also looking forward to secondary reference measures that are also on a high quality level. And further points like in line with the process framework process from Sarah Kiedel is that we also have to keep in mind we need laboratory and naturalistic conditions, especially the latter one part. We should validate a range of activities. We should keep an eye of how we handle the data in terms of synchronization. We need diverse samples. And definitely an important step forward is to find an agreement of how we should analyze validation data. And when we look at the last step, the reporting part, we can see here some quotes from those works. And we need reporting to compare studies, to navigate the market, but definitely we need to understand and compare the accuracy of such devices. And to tackle this issue, we started some network activities. And here is one part what we are currently doing. It's a Delphi study, very similar to Grace, what she presented earlier, just with a clear focus only on performance evaluation studies. So what we have done so far is we selected items based on existing literature and co-authors. I'm very happy that we have a long list of experts in our team from different areas. We you can see here just a screenshot. So we ended up with a table with 92 items, split it for introduction, methods, results, and other areas. And of course, in the first step, the idea was to identify as many as possible items, and hopefully the Delphi process will sort out the most relevant items and those who are not so relevant to report. Thereafter, we try to identify a large number of experts who can guide us through the process. So we used our living review database. We asked co-authors about recommendations, and we tried AI-assisted approaches to identify experts in the field. And we invited at the end over 600 experts. And right now we are in round one. So if you are listening and you were not invited so far, just contact us. We are happy to invite more and more people. And we will hopefully close the first round end of November. We are planning to set up the second round next year at the beginning. And hopefully in spring 2026, we will have a final publication. So now this is quite important for me. If we will end with this this project, and we will identify relevant items to report, what should we do with these relevant items? We can, of course, use it as a classical checklist, but I would not prefer to go this way, because if we use this checklist, we will still have a time burden appendix for everyone. We have to mark page number and lines. So I would like to think about restructuring the article type for evaluation studies. And I will give you an idea why this could be important. So we randomly picked 8 studies from our database. And what you can see here is just from submitting to accepting this article, the average duration was 8 months. And we're just talking about the final manuscript until it is published. And we do not talk about planning the study, recruiting participants, performing the evaluation studies, analyzing the data, writing the manuscript. So I would say we need definitely 1.5, 2 years until start to the end. And during this time, probably the device we tested, it's not available on the market anymore. If you know the short product life cycles from commercial trackers, which are more and more important to our research, but also research-grade devices may change their algorithms, may change their products. So what I would prefer, but we cannot solve it alone, we need the support from the whole field, I would say. This is a wild guess. Maybe we will identify 50 items out of those 92 items. And what we can do in the future, maybe, to restructure evaluation articles in terms, do we need, for example, a long introduction for those studies? I don't think so. But for us, it's important to know the methods, the results. And our idea is hopefully we can identify the relevant items and to standardize, for example, some tables. For the method sections, we need a table for the reference measure, one table for the testing device, clear tables for the analysis, and a short discussion. I think this is sufficient, and hopefully this could change a bit the long term between submitting and accepting manuscripts in this term. So I will go ahead. This is just another action we are currently doing. Right now, we are also working on transferring our systematic review from the beginning now in a living review process. Right now, we already are in the phase of data extractions. We identified 263 studies between 2022 and 2024. We hope we can finalize this project until end of this year. Then we want to update our results on the website, and also to summarize it in the publication. And this will go into our large database, and hopefully we will continue our work and motivation, of course, to update this work yearly. So to finalize my talk, I hope with this activities I presented right now, we can find the balance between resources and relevance. We put a lot of energy now into the network area. So we tried, without any funding, bring experts together and work on specific activities. But of course, we need funding at a certain point to keep this keep on track, and also maybe a stronger collaboration with industry partners. And at the end, I have to say thank you to a lot of people. Just an illustration. So right now, nearly 100 members are actively displayed on our website and supporting our ideas. And here, just two special groups. Of course, our management group, a huge thank to them, who's actively working on our ideas, and our advisory board, who navigates us and yeah, guides us to the right directions. And if you're interested, just let us know. We are open to different ideas in the space of wearables in general, and to work with people. So thanks a lot for listening, and happy to answer questions.